Vaccine cures HIV-like virus in monkeys. CBS News. cbsnews.com/cbs evening news /cbs this morning /48 hours /60 minutes /Sunday morning /face the nation. Video. U.S. World. Politics. Entertainment. Health. Money Watch. Sci-tech. Crime. Sports. More blogs. The feed battleground. The WH Web Show 60 Overtime Face-to-Face Resources Mobile Radio Local. Log in join cbsnews.com sign in with profile. Manage my newsletter subscriptions, update my email address, change my password, log out. By Michelle Costillo /CBS News /September 12, 2013, 2:31 p.m. Vaccine cures HIV-like virus in monkeys. To stack photos. A vaccine has successfully cleared the monkey version of HIV from the bloodstreams of infected animals, leading scientists to believe they may be able to replicate the effect for humans with HIV. To date, HIV infection has only been cured in a very small number of highly publicized but unusual clinical cases in which HIV-infected individuals were treated with antiviral medicines very early after the onset of infection or received a stem cell transplant to combat cancer. Dr. Louis Picker, Associate Director of the Oregon Health and Science University Vaccine and Gene Therapy Institute, said in a press release. This latest research suggests that certain immune responses elicited by a new vaccine may also have the ability to completely remove HIV from the body. The U.S. Department of Health Human Services reports that about 1.2 million people in the U.S. are living with a human immunodeficiency virus HIV, the virus that causes AIDS. 1 in 5 people living with HIV are not aware that they are infected. 11 photos. Man cured of AIDS. Timothy Ray Brown. Play video. Activists optimistic that International AIDS Conference. The researchers tested a vaccine for a specific kind of simian immunodeficiency virus SIV called SIVMAC 239 on 16 rhesus macaque monkeys. This version is up to 100 times more deadly than HIV, and monkeys typically die within 2 years. The vaccine used the cytomegalovirus CMV, which is part of the herpes family. Researchers modified the virus' natural ability to spread through the body, instead having it tell all the various parts of the immune system, particularly the T cells that can fight off SIV infection, to target the SIV. All the monkeys were vaccinated and then exposed to SIVMAC 239. In 9 of the cases, the monkeys' immune systems were able to fight off infection and destroy the virus. Those monkeys remained infection-free between 1.5 to 3 years later. It's always tough to claim eradication. There could always be a cell which we didn't analyze that has the virus in it, Picker told the BBC. But for the most part, with very stringent criteria, there was no virus left in the body of these monkeys. Researchers are still trying to determine why it worked in some of the monkeys but not others. It could be the fact that SIV is so pathogenic that this is the best you are ever going to get, Picker explained. There is a battle going on, and half the time the vaccine wins and half the time it doesn't. Play video. AIDS doc director talks about plague, Oscar Nod. In July, doctors at Brigham and Women's Hospital in Boston reported that 2 previously HIV-positive men who received stem cell transplants to treat their lymphoma cancers were cured of HIV. Another HIV-positive patient who received a stem cell transplant to treat his leukemia, Timothy Brown, has also reported that he has been cured of HIV. While researchers found traces of HIV in his tissue in June 2012, Brown said the virus is dead and cannot replicate. In Brown's case, the donor for the stem cells was part of the 1% of Caucasians that has a genetic mutation called Delta 32 that makes them resistant to HIV. The 2 Boston patients' bone marrow donors did not have the Delta 32 mutation. In another highly publicized case, the Mississippi baby born HIV positive was reportedly cured of the virus as well. The child was immediately placed on a 3-drug infusion treatment within 30 hours after birth, something that is not typically done so quickly. Doctors did not know her mother was HIV positive until she was in labor. The researchers in the latest monkey study want to try the vaccine method on humans with HIV, but acknowledge that they still have to make sure it is safe. They hope the first human clinical trials can start within 2 years. The research was published in Nature on September 11.